Ladies and gentlemen, it is the Dr. Patrick Flynn Show, and we are kicking off Breast Awareness. It is October in your breast interest. The host of the Dr. Patrick Flynn Show, and it's going to be an amazing Tuesday. It's October 2nd, and we are kicking off our Breast Awareness Month, and we are calling it In Your Breast Interest. But as you can see right now, I'm sitting up here all by myself because Dr. Patrick Flynn has been training out in the community. He got called up, and they wanted to do some personal growth and development with him, so he's literally on his way back. He's had an exciting morning, and I'm excited to be able to be here because I know he's going to come running through, and he's going to just be rolling down the river, rolling, and I know I just heard him pulling in the back, and this is it. This is the man, the myth, the legend, ladies and gentlemen. He's going to be running in here. He's probably going to be out of breath, but I know he's going to have amazing things to say, especially as we come to you on the topic of breasts. Hey, look at this man right here.
What's up, man?
What's going on?
Well, see,
dude, you literally I heard you pull up in the back, and I'm like, he's here.
Yes.
It's beautiful. What have you been doing?
Except for I'd never be out of shape like you, so I'm always in shape. So I'm not a breast.
Well, there's a difference. This is a shape, and this is a shape.
That's
so,
right.
I mean, out of shape, in shape. I don't know. Talk to me. So you were just doing personal growth and what?
We're not even Wellness Way branded today. We're kind of like...
Yes, we are. We are Wellness Way branded.
Well,
look at us.
I love gray.
Look at us, though. We are Wellness Way branded.
You mean we're the face? Oh, we're in trouble.
No, I mean, for 63 years old, you look pretty good.
Not bad.
Not bad at all. So talk to me. Literally, you were just training. So where were you at?
Yes.
What were you doing? Talk to me.
So I got asked to speak at an organization that has recognized not only what we've done in healthcare, but then they started catching attention as far as like, I truly believe this. And like I said, and I know our show is but there's a stress component that I believe is so important to health. And so that's why I really started getting this a long time ago. I truly believe that you can never do anything great or significant without other great people.
Yes.
And the thing is this, and my title was basically that, you can't do anything without other, significant without other great people, but most people suck.
Yeah, and then you always talk about this too, when you're on top, it's a lonely place to be if you're there by yourself. Because you recognize that the people underneath you are what sometimes help you get to the top, but they should be there with you.
Well, and the funny part is that even that motto, that language, which you hear so much that way, and thanks for putting it that way, is there really isn't a top. See what I'm saying? Because I can tell you right now, that Dr. Jason is top of his expertise. I can say that Dr. Greg, I can say that you, I can say that Nancy, I can say that Heather, I can say that Brianna, I can say myself, are top at what we do. And so if we each work on our God-given crafts every single day, daily, not weekly, daily, and we all come together under great organization, and that's where Kim,
and
Dr. Jason's wife,
mm-hmm.
you know what I'm saying, is actually, she's actually, I tell her all the time. She's like, she said this to me the other day. Kim says to me the other day, and it was kind of funny because Dr. Jason and I were talking about it, and Dr. Jason and Kim are together. They have two awesome kiddos that way. And Kim says, Patrick, she goes, you always say I'm the orchestrator of the whole orchestra, and Ross plays the flute, and
is that right?
Actually, he was a trumpet player.
Flute, yeah, okay. He was a trumpet player. Yeah.
Nancy plays it, and he goes, but wait. She goes, where are you in the thing? I said, I own the whole damn theater.
Yeah, you're taking up space.
That's what you're saying? Yes. I said, I own everything. You know what I'm saying? So it's like,
good.
You're the orchestra, I just own the band. Okay?
Yeah,
But the point is but it doesn't matter our role. As a building owner, I have to contribute to put the best performance on. And that comes from the best people. But here's what I'll tell you. People are not born great.
Yes.
Don't confuse a skill with greatness. There's a lot of people that are skilled that suck in life in all areas of life. You're saying even though they're skilled amazingly, it has to be grown and developed. Yes. So I got asked to speak at this corporation, this company, this beautiful place that has an amazing man who is doing great things, but wants to be able to build a culture that's affecting change all over the United States, all over the world.
Yes.
And so he brought me in to speak. Mm-hmm. And guess what? There was tears.
Oh, was it really?
Yeah,
well,
there's
it's you
women crying,
talking. I mean, you just bring people to tears all the time.
And so it's like, and there's some people that are upset, which is great. You know what I'm saying? And I love it. Not upset in a negative way. It's like, it's gonna...
When you challenge them. When you challenge people with the truth and you put out in front of them the decision to actually change something about themselves, I mean, you're either going to become emotional or, you're going to get upset, but it's not a direct reflection on you and your teaching. You're just upsetting the apple cart internally.
Yeah. Well, I said when people suck, they argue about everything.
Yes.
Do you understand?
They like to point the finger and blame.
Yeah, instead of reflecting
and take responsibility.
Is he saying something of value, or is he actually just trying to sell people and stuff?
That's
and
right.
Like that.
That's good.
And you can always see the next used car salesman.
Yeah, it's just like the quote that we've seen. Talent does not always beat the hard work. Sometimes those who put in the hard work at the end of the day will really be the ones that will outperform, and do those who have raw talent.
In most organizations, what happens is this: is if people develop their skills that I would say God has given them, they can accomplish anything in that arena. I will tell you this: Michael Jordan and I, if we play basketball,
he will win.
He will win. You say, see, so I'm not trying to be Michael Jordan, and I don't want Michael Jordan to try to be me because it'll be disastrous that way. But guess what? But we both can be Michael Jordans at our craft if we know ourselves. And even though I spoke at a great organization, you'd be surprised how very little of them knew who they really were.
Oh, sure.
And I said, so you showed up at this company, and you're not showing up with who you are. You're showing up with your representative.
Yeah.
And I don't want to meet your representative. I want to know who you are. That's why if you're around me, I want to get to the core of who you are.
Yes.
Do you say? And some people are scared about who they are, or don't even want to do it, or they, for example, they're ashamed of something that they think or do. I'm like, guys, if that was the case, I'll make everybody feel good. Because what I think and do stuff, is like people are like,
yeah.
See, people just feel good around me because they say, listen, if Doc can do it, anybody can do it.
And I think that's the whole premise of a lot of the stuff that we teach upon and that we put out. It's authentic, it is raw, but at the same time, I think it's really what people are looking for. And I think people are getting to the place where they're tired of disingenuine facades that are being put out, especially when you're in an organization and you're working with CEOs, managers, owners, and founders. People just want to connect, and they want to feel like they're a part of something that's bigger than themselves. They don't want to be a part of something by themselves. It's shoulder to shoulder. It is teamwork, as we say. It makes the dream work, and us, we, our culture.
Yeah. Well, and I said, it's about bringing greatness out that you can see in other people that way.
Indeed.
And actually, it's kind of funny. I heard the analogy. I don't know who did it, but I want to give him credit, but I don't know who did it. So if you guys know the person who created the analogy, it was, when you light another candle, it takes nothing away from the original candle.
I don't remember who said that.
Do you see him?
Yeah,
so that's why, but the room gets a lot brighter.
A lot brighter.
Do you see him? And so that's why when you can pour into somebody's life, it doesn't take away from you. When I talk about your gifts, which are not mine, it doesn't take away from me. It actually recognizes that this room is brighter.
Exactly.
Do you see him? And we bring sunshine.
Yeah. Oh, we sure do. No matter where we go, we bring sunshine.
Yes.
But to be honest with you, I think today we might actually come in the form of a cloud for some of you who are thinking about the topic that we are going. Because I believe that there's a lot of misinformation out there, especially when we're talking about.
He's springing this on me.
Yes. Breast awareness. It's October.
What awareness?
Breast.
Oh, okay.
In your breast interest.
Yes.
We're seeing it now. We see it in all this NFL. We see it in sports. Everybody's putting out pink this, pink that, ribbon here, ribbon there, ribbons everywhere. And there's a lot of misinformation about this. And you are highly opinionated in this area when it comes to breast awareness.
Yeah.
You got a lot of things to say. I mean, there's a lot of things we're going to be talking about, everything from bras and support, and he already talked about that a little bit a couple weeks ago. But healthy tatas, we had an article that we did months ago.
Yep.
But even testing, all this stuff that we can talk about. But one of the ones that I want to really kind of kick off with you today is this whole pink ribbon movement.
Yeah.
Talk to me about it, because I know you just love it.
Well, let me put it this way.
Raising all this awareness and all this money.
Well, see, it's like this, okay? Awareness of driving off a cliff is still, you're driving off a cliff.
Yes.
It's like, and you can tell people it's stupid if you sit at the bottom of the cliff and try to help people when they've already drove off the edge of the cliff.
That's right.
I'm saying get up there and tell people stop driving off the darn cliff and stop trying to make the care for the person that crashed at the bottom of the cliff better and raise money for it because it's stupid. You know what I'm saying? Because you're wasting efforts downstream that make no sense on there, okay? So what I'm going to do this. So instead of actually talking about pink ribbons, let's talk about the thinking that gets people so mad about it.
There you go.
Because here's what happens. Is all of a sudden somebody actually came up and they're 42 years old and they have breast cancer. So what happens is because they go through something very emotionally, they don't want to see other people actually go through that, so they want to bring awareness to breast cancer. And they say, well, get all your early detection mammograms because early detection is the best thing. No, it's not. It's a wrong thinking.
Right.
I'm saying that when we're having arguments over when a woman should get a medical procedure done to check for breast cancer, I'm sitting there going, you should be 13, 14 years old testing your hormones. Because anybody that gets breast cancer, they put you on a estrogen-lowering drug. Well, why don't we see what made them go up and make sure they don't go up since you're little? So, so instead of worrying about pink ribbons, you actually go after true prevention. Do you see what I'm saying?
But I think you're, careful now, because I think you're going to offend a lot of people here, because there are a lot of people who probably have contributed, to the pink ribbon movement, and also who have had family members, they wear the pink ribbon themselves. My mother is a breast cancer survivor, so we identify with it, right? Because it's an emotional connection. But now what you're saying is that you need to obviously be a lot more forward thinking and start this at a young age. And by the time most people want to cling on to the cause of the pink ribbon, it's too late.
Well, that's like people saying, I can, at 40 years old, because that's average when people a lot of times get breast cancer, so that between 40s and 50s, they say, you know something, I'm going to warn you that guess what? That you could drive off a cliff. But don't worry, we have procedures that at the end can help you with it that way. I'm going, don't drive down that same damn road.
Right, exactly.
Do you understand?
Yes.
It's like there's a different path to take. And because see, the cool thing is, I just had this conversation. Now, Ross, you know this, okay? Nancy, you know this. For Ross, you've known me a long time.
Yes.
Okay, think about this, and be sincere about this. Has my message ever really changed in 20 years?
No.
But see, what does now is this. When I was 24 preaching this, and I had zero money, and no company, and no influence, they told me to shut up.
Yep.
Now that we have a $30 million company, and we have offices all over the country and stuff like that, now they're starting to listen to a little bit that way.
Right.
But the idea hasn't changed.
Correct.
Do you see what I'm saying? And see, that's why I tell people, say, listen, and so my language has not changed. I don't care if you care about pink ribbons. I really don't. I'm just saying, by the time pink ribbons are important,
it's too late.
It's the thinking that led you to have to even deal with a pink ribbon in the first place.
Yes.
I'm saying change the thinking before that, and then pink ribbons are not even associated with your life anymore.
Right. And aren't we seeing breast cancer earlier and earlier and earlier in women today? So you're saying 40s and sometimes 50s, but there's stories out there.
Oh, I know women in their 20s.
In their 20s.
I know women in their 20s. Heck, but you remember this, Ross, when I started practice, type 2 diabetes was called adult onset.
Yeah.
Now they changed that name because kids are getting it within a couple years of age. Do you see what I'm saying? Chronic illness because we are getting so sick. See what we did. So let me give you a timeline. And this is the mental confusion. And I'm coming along pointing this out, and people get downright emotional because they don't sit back and shut their pie hole.
Yep.
They want to argue. See, because here's what happens. If you go back 200 years ago, our life expectancy was less. Do you see what I'm saying?
Yep.
Now, because of medical procedures, we extended our life. Mm-hmm. But chronic illness is rapidly going, so we extend our life, people are living longer.
Yes.
So grandma and grandpa are living longer. So those are the people that end up with diseases. But then the thinking that's perpetuates some of the long-term longevity, as far as not dying at 30 or 40 years old, they think they can apply that since you're a kid, and now that all chronic illness is actually getting earlier, and that life expectancy is getting less, even though techniques to keep us alive are getting better.
Interesting.
So once again, what's wrong?
Right?
Thinking.
Yes.
So I don't have any problem with it. I really don't. This sounds funny. I really don't have any problem with a medical procedure if it can be justified to keep you alive.
Right.
Do you see what I'm saying?
You mentioned that in your hormone connection, which we just
Yeah.
had in Oshkosh with our
Which was
Appleton
packed.
office in Fond du Lac. It was huge. But I love it when you open that up and you're like, with me as a doctor, with all of the education that I have, or any of the Wellness Way doctors, if you and your husband all of a sudden has a heart attack, do you want us digging in the drawer, pulling out a knife, and performing open heart surgery to save
No.
his life? You say no.
We look like a moron.
Yeah. Call 911 and go get them immediate help.
Because over the last 100 and some years, we've created systems to help us survive that.
Correct.
But don't confuse surviving breast cancer with understanding breast cancer and knowing what to do to prevent it.
That's good.
Early detection is not prevention. Early detection is you're sick, we found it. Now, yes, it's easier for a 40-year-old woman to recover than it is a 70-year-old woman.
Sure. Yep.
But early detection does not mean prevention. It's the same thinking that got you breast cancer in the first place.
But I mean, it sounds great.
Well,
it sounds
it's a
like
great
they're taking
catchphrase.
proactive steps to really take control of their health care. I
Yep.
mean, it's early detection. I'm taking the right steps, Doc. I mean, I've heard about all these things, the BRCA gene, or maybe it is genetic, I don't know. But so the younger I am, I'm going to get tested, and
Yep.
just see. But you're saying, no. Change the way you're thinking. Go back even younger.
Well, if you think
set
of it this
yourself
way,
up to succeed.
I went into the company today that I spoke at, and I didn't change their product. I didn't change, for example, what they were doing, but I changed them and how they think.
Yes.
And now their company's going to grow. Do you see?
Yep.
And it has nothing to do with their product. The Wellness Way is a product that's really established by changing people's thinking, because let's say that I had an herb right here. And yes, the quality is great, but the thought process to when to use that or not to use that or how you use it is what's based on the result, not just because you take it.
Sure.
Because you can actually take even an herb and it can be destructive to your health. That's why, for example, you can't just do things by yourself based on, just trying things because you heard this helps somebody else, because it can actually cause detriment to you.
Yeah.
You see? So I said, it really comes down to, I have no problem with the pink ribbon movement. What I have a problem with this is that that's the standard for breasts.
Yes.
Because I can tell you right now, boobies are suffering out there right now. Doc, how can you say that? Breast cancer and the amount goes up every year. The amount of women diagnosed with breast cancer every year is dramatically increasing every year. Our boobies are in trouble.
And this really all stems from
Thinking.
hormones and thinking, but hormones probably just being out of whack.
Well, think of it
Thus
this
the
way.
importance of
So
testing.
let's even go back to the clinical aspect.
Yeah.
So if you're a medical doctor or anybody watching right now that can prescribe a medication, it's medical standards. So this is nothing to do with me, my opinion to that. Medical standards that you are put on an aromatase inhibiting medication for minimal 5 years. Now they're trying to stay the rest of your life. What does that medication do? It knocks down all the estrogens, because the only thing we know right now that actually is a major contributor to breast cancer is
High estrogen
certain
levels.
high estrogen levels. That way,
Yep.
people don't realize some estrogens protect the breast, but they don't test them ever. They knock them all down, and it's not your gene. It's not your gene at all. The gene has to be triggered by the hormone. The gene has nothing to do with it.
Sure.
The gene. Now, if you have the gene and bad hormones, you're going to get cancer. But you can have genes and normal hormones, and you never get cancer. See what I'm saying? And see, but what happens, they don't want to say that. They want to say, look, you have the gene, cover your boobies. Think about it this way. We've accepted this as a form of healthcare. Get rid of your boobies. Do you understand? Get rid of your
Yes.
boobies. Great job, guys.
Yeah.
Wonderful prevention. Just don't have it.
As if the cancer just only resides in the breast material.
Yes.
Tissue, excuse me.
Tissue,
Right?
yes.
As if it's only there, right? And not even connected to the rest of your body.
That's right. You know
Your
what I'm saying?
lymphatic system and so much more.
Well, yeah, that's why, for example, most cancers are never individual problems that way. You understand? And so that's why it's like, a person has a breast cancer, they have other things that are actually contributing to what's going on, and also they're suffering from other things going on. See, so it's really once again, what it comes down to, and I can honestly tell you, and I think it was Napoleon Hill that said this: if you change your thinking, you change your life. And that applies to everything. That applies to healthcare, that applies to business, that applies to marriage. And all you have to really do is this, guys. I know it's general, but let's think about this. Across the world, all chronic illnesses are skyrocketing, no matter who pays for it.
Sure.
So the debate on who pays for your health care does not change healthcare statistics. You saying? It changes your own financial pocket. That's why there's political arguments about it. Okay?
So have we seen more of a political arena created for this by only taking, let's say, a month, October, and it's not glamorizing, but you're putting it out there in the forefront where you're focusing on breast cancer and the awareness of it. 1 month out of 12 years. Now, ask the person who is actually going through breast cancer.
I was going to say,
hello.
You don't have to really do a cancer month because statistically, in the United States, 1 out of 3 people end up with cancer. I don't really think we need a cancer awareness month. We need a how stupid our thinking is month.
Absolutely.
Do you know what I'm saying? And how dumb what your thinking is about boobies is.
Yeah.
Jeez, I just love the term boobie. I just love the booby. I
great.
hate wearing breasts.
Yeah, we're just gonna roll with it.
Boobies are just a good term. Do you say
Yes.
As people say, Doc, Ross saying breasts, you're seeing boobies. Boobies just sounds better.
Boobies, we can't say in your boobie interest, though. It's in your breast interest. That's,
In your breast interest. Okay,
that
that's a
is
good one.
awesome. So,
Who created that?
Who? In your breast interest?
Yeah.
I think we did.
No,
a couple weeks ago.
I didn't. Who did it? Someone
Who
in the
did
company.
what?
Who created the catchphrase? In your breast interest. Who did that?
You guys did.
I think we did on the show a few weeks ago.
Yeah.
Absolutely. We were talking. We're going to do it right
Nancy, you think it was me?
Yeah.
No. Okay, here's what
I'll
happens.
take
It has to be
credit
Ross.
for it. I'll just take credit
It has
for
to
it
be
right
Ross
now.
because I'm not that creative.
Be our guest. Be our
Let's-
guest. Let's talk about some breasts. Anyway,
See?
so
Hey, I'm going to Disney next year, so that's going to
sweet.
think in my head.
But I don't know, because it's just like, as a former, pastor, if you will, it was always interesting, Christmas, what did it do? Heighten the awareness of our need for faith and Jesus. Well, I'm like thinking, there's
Really?
still 11 other months.
Yeah.
11 other months.
So it's
Breast cancer awareness,
that's like
October.
That's like when Cheesters, people that go to church Christmas and Easter.
Creasters, yeah.
You know what I'm saying?
Yep.
It's like, yes, I'm going to show up, and that way, yeah, right. What happened about the other 364
Yes.
days or 63 days that you missed church?
And what's the whole goal of them? Are they raising money to truly fight breast cancer and come up with solutions?
No, it's once again, it's so money oriented that way. And what they do, but they pull on people's emotions, and that's why some people will even send me. It's kind of cool, guys. It's not a joke. Brandon saw it that way. Brandon's like, Patrick, you got another great email from somebody. And this woman, even Brianna's laughing right now. She obviously worked in some fertility clinic. And of course, she didn't like my comment about fertility that way. It's like, girl, check your. She even called me an a-hole. You
Nice.
understand? You know something? But anybody can be a keyboard warrior ninja. So I responded back to her. She's like, you got to get them to a proper doctor. I'm like, really? I have clinics all over the country doing this clinically every single day, and your opinion means jack crap to me. Do you understand? And so it's kind of fun. It's like your words mean nothing that way. And literally, it was kind of funny. It was like this long thing about how I'm hurting women by giving this information. I'm like, really? Breast cancer is at all-time high. Infertility is all-time high. If there's anybody, and so young lady, if you're watching this, and what happens is I would put your name publicly. I should do it anyways, but I won't.
Be nice.
I don't want to be nice.
I don't want to be nice. Yeah, you've
But
kind
I
of
will
been in
be-
that mood.
What's that?
He's like, I don't want to be nice.
Well, what happens, remember, their actions and words don't dictate who I am.
Correct.
And stuff like that. But when you're stupid, you're stupid. And this girl is stupid. Okay?
Stupid is as
and
stupid
she
does.
was a moron. Okay? Because what happens is she couldn't tear on what we were doing. She was trying to tear on who I was. She's like, you're just a chiropractor. Well, let's look at how the medical profession is doing for breasts. It's going bad.
Yeah, it really is.
Do you
it really
see
is, yeah.
You're giving women bad advice. Really? Because I can actually tell you, with all the clinics, I can tell you we've had thousands and thousands of women that were told they can never have babies that now have children.
Have children,
And some of these
correct.
watch this show every single week.
Absolutely. And here's, just kind of a little, it's not really a squirrel, but it's a little bit of a gender skew, because breast cancer is on the rise.
In males.
In males now.
Yes.
And so, when we talk about women really, getting beyond this idea of early detection and all that stuff, you're really talking about fostering an atmosphere of ownership of your healthcare that starts at a young age, with parents teaching
Yes.
their kids proper nutrition, proper healthcare, all that stuff. But now when we start talking about guys, how do you begin to put that on your radar? Me. What do I think? Early detection? I'm thinking I'm a dude. I don't have breasts. It's not
Yeah.
going to happen to me. So
But
I
you
don't
know-
need to get tested.
But you know something? You know what you were doing the other day?
What's that? Was that
You were taking your vehicle to get an oil change. Why?
Yeah.
The engine's not smoking. The engine light's not on. Why freaking take care of your vehicle?
Because it's the right thing to do.
Men take better care of their vehicles than they ever do their body. You understand? I always tell them, why do you go to the gas station and put gas in there? Just try to put some alcohol, put some water in there. Heck, take
Sugar.
a pee in there. I don't care. But
Yeah.
why would you put it in there? Because it wouldn't run.
Yeah.
Well, then why do you put that kind of crappy stuff in your body and expect it to run properly? Do you see him? So I have no sympathy for guys when they're sick as can be and they make dumb choices.
Sure.
So, yeah.
So really, okay then. I know seems to be more of a gender-specific issue when we start talking about breast cancer and we start talking about, mastectomies and all this other stuff, right? But how do you really now begin to put this on the radar for a guy, or even for a wife who might be concerned about his husband?
Well,
maybe there was breast cancer and his mother and grandmother.
I had an email when I was in New York. My beautiful bride was sleeping, and so I pulled out my computer. I was sitting there typing. And it's funny because I wanted to somehow bring up this question, and you kind of set the stage for it that way. See, what happens is when people are going through tough things, what happens is what they'll do is they go and look for a certain amount of care. Okay,
sure.
and I tell people once again is when you look at once again what you want to do with your health and your body that way, you need to actually come up with a different kind of parameter that way, and that's why testing is so important. Okay, so she's literally texting me going, I want to bring my life in a different direction. What herb, what thing should I start with? I'm like, young lady, nobody knows what your body needs until you're properly tested. And she says, Doc, and she responded back. She says, Doc, you kind of say the same things all the time. I said, well, let me ask you this. From when I start practice, I can pull out the stats. Every year, heart disease, cancer, breast cancer, everything goes up like crazy. If I don't keep saying the same things and people go in a different direction, what's going to happen 20 years from now, Ross, where we saying the same things
over and over and over? Yes.
See, so sometimes people are tuned in looking for this magic idea. I'm like, the magic idea is just like I tell people why their personal growth and stuff is so devastating to them because they don't know who they are.
Yep.
And so they can't walk confidently in life. Most people can't be healthy because they don't know where their health is because they never tested. They actually test pink ribbons and wait till you fall apart.
Yes.
Get tested. Nancy, post the link for the hormone test, the Dutch, and post the lab for actually the blood work.
And that's just as relevant for men as it is women?
Men and women.
See that? Okay, so now that you're saying that, I think when we talk about the Dutch test, the hormone test, especially we know that our audience is predominantly women, right? Okay, so when you start talking to them about hormones and they go yes, 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 and yes. But a guy would think to himself, dude, it's testosterone. What do I need to get tested here?
Yep.
You telling me that I have
just
estrogen?
Post it. You don't need us as a doctor.
Right.
You don't. Just get those tested. Please. That's it. I know I'm repetitive, but I'm repetitive because I actually every day have to travel all over the country. Every day I have to walk into clinics. Every day I got to walk into the Green Bay Clinic and watch the devastating things that people are going through because they've never got the simple concept of test properly for their health, not wait till they have a disease and throw a party with pink ribbons looking for fundraising to bring awareness about a disease that already happened.
And there's a lot of people that come to us and say, well, I have been tested.
Yep.
I have been tested not only once, twice, 3 times a lady.
Well, get this.
But with no thorough answer.
Yeah, because you've been tested by a doc that has no clue what they're doing.
Yes.
It's why, once again, when I said this 20 years ago when we started, it was me in a dead-end warehouse at the end over here in Green Bay. And now that we have a brand all over the world now starting to actually make an impact, people now are starting to go, well, maybe I should start doing that.
Right, exactly.
And so that's why, and I want to end on this today because I know we got about 2 minutes, guys. Going to teach at that company, guess what happens? Was an actual blessing. So I want to thank the person that brought me in that way. I want to thank for those people that were crying, that were mad at me, that sometimes didn't like what I had to say, but they were moved by my words that way. And here's what happens is this. All coming from a young man and a team that, we're just a bunch of misfits.
Bunch of misfits that shouldn't have ever amounted to anything.
And guess what? Nancy, Brianna, Heather, get your butts up here. Get your butts up here. Come here, Nancy. Come here, Brianna. Come here, Heather.
Come on up. Yo, the next contestant
come on behind
us. The Dr. Patrick Flynn Show.
I can also tell you this. For example, all these young ladies behind us and all the team across the country, and I don't know why, but popped in my head, Dr. Kelvy.
Yes,
our
Southern Belle.
She's awesome. You look at Dr. Fawez, in San Francisco. We're all just a bunch of misfits that love what we do.
Yes.
Do you understand? And guess what? See these 3 young ladies behind me? They all have greatness and their gifts are different than mine. My best friend, who's probably one of the most incredible men, no, by far, you are one of the most incredible men I ever met in my life.
Wow, dude.
Of that.
Thanks, man.
But not by what you do, it's because who you are. I know you are as a person of faith. I know you are as a husband. I see your incredible kids. I see how you treat other people. I see that about these young ladies behind there. I watch a 22-year-old young lady over to our left, Brianna, who I've known her mom and dad. I remember when she was a little girl, okay? And now, as a young lady at 22 years old, she's making an impact for people all over the world.
Yes.
And most people don't think they could ever do that. Brianna, do you ever think that you were going to make a big change in people's lives? No. But she is. See, that's what it's all about.
Yes.
So now, take your gifts and end the show.
End the show. See, that's what it's all about here at the Dr. Patrick Flynn Show, here at the Wellness Way in Green Bay. It's not only personal growth and development, it's talking about health concerns, and it's also talking about business. But really, with us here, the three are one with us, and you get that every time we come to the table. You get raw,
Because
unscripted.
it's about other people.
Other
And I'll tell
people
you,
unleashing their greatness.
Every one of
Yes.
our docs, I know I didn't say their name, but it took me a long time to go through this. If it wasn't for
Absolutely.
their staff and stuff like that, the people that they have around, just like we have Nancy, Heather, Brianna, everybody around us that way, they're all amazing people.
You bet. So with that, ladies and gentlemen, we thank you for joining us for another episode of the Dr. Patrick Flynn Show. It is October, like I said, the 2nd, in your best interest. We'll be back with that topic again next week. We'll see you then.